Hi, everybody. I'm Catherine, your instructor, and I'm going to be facilitating this scenario today. I've assigned your roles. Beth, you're going to be the charge nurse today. Okay? Your job is to prioritize and delegate orders to your team and assist when needed. Also, you will need to be calling the doctor with any updates or changes in your patient's condition.
Right.
Okay, Jen, you're going to be our bedside nurse today. Your job is to obtain objective and subjective data on your patient, continually reassessing him. You're going to be communicating with your team, keeping them updated as to your patient's condition. Amy and Carolyn, you are medication nurses today. Your job is to safely administer medications the physician will order. You also need to maintain contact with your team, and especially with Kathy, who is our recording nurse today. She will be at that whiteboard over there, and she will be documenting all the data from the assessment, and that will help Beth when it's time to call the doctor and update him. Okay? Okay, Beth, go ahead and read the patient history.
All right. Well, according to our history, this is Mr. Stan Walker, who's a 33-year-old male who was admitted through the emergency department after being seen by a nurse at his employee health clinic with a 2-day history of nausea, abdominal pain, and fatigue. Upon arrival at the clinic, the nurse did notice some slight confusion as well as a fruity odor from his breath. She attempted to check his glucose levels, however, the result was too high for the machine to read at that time. So in the emergency department, they were able to go ahead and insert a right subclavian triple lumen as well as a peripheral line in his right AC. They did administer a 1-liter normal saline bolus, and they started maintenance fluids of normal saline at 500 milliliters an hour. Labs were drawn, and his admitting diagnosis is DKA. So since it says here that they did draw labs, by any chance, are those results back yet?
Yes, they are.
Okay.
Here they are.
All right, let's see what we got. Well, his glucose level sure is high at 540.
Yeah, and his sodium is low, so he's probably got some dehydration.
Right. And the white blood cell count is high as well, so maybe he's got some sort of an infection going on.
Mm-hmm. And his serum
Find out.
CO2 is low, so probably some metabolic acidosis.
Yeah, I agree.
And here are your admitting orders.
Okay, let's see here. I'd like to start with the medication nurses. I'm going to need one of you to go ahead and check the patency of all ports of the triple lumen, and don't forget about the peripheral line too. Also, I want you to verify that the normal saline is being administered at the prescribed rate. After that, we really need to focus on the insulin because that's our major priority with his glucose level being so high. After that, you guys can worry about the antibiotic. And then I think, we still have the Tylenol. So we'll get his vital signs, get his temperature to see if the Tylenol is even necessary. Okay?
Okay, I guess I'll get my vitals and
Right.
start my head to toe.
Yeah, start with your vital signs, and don't forget to get a urine output when you're getting his head to toe assessment because he does have that Foley catheter.
Okay, I will.
Okay?
Good. Hi, my name is Jen. I'm the nurse that's going to be taking care of you today. Can you tell me your name and date of birth, please?
Oh, hi, Jen. My name's Stan Walker, and I was born October 30th.
Okay, and do you know where you are and what day it is?
And I don't know, is it Friday?
It is. That's correct. It is Friday. How are you feeling? Do you have any chest pain or shortness of breath?
No chest pain, but I do feel like I'm having a hard time stopping my breathing. I just keep breathing so fast, and I feel so tired and sleepy.
Okay, Mr. Walker, what I'm going to do is I'm going to get some vital signs, and then I'm going to go ahead and do a head-to-toe assessment.
Okay.
Okay, Kathy, we have a temp of 40, heart rate of 119, blood pressure is 80 over 50, pulse ox is 97% on room air, and that blood pressure is still low. When did they start those fluids?
You know, I was just looking at that. It looks here like they started those fluids right before they transferred him to the floor.
Okay.
So how about in the meantime, maybe while you're getting your assessment, lower the head of the bed,
Okay.
and then we will need to make sure that we reassess that blood pressure once the fluids have had a chance to kick in a bit.
Okay.
Okay?
Sounds good.
Thanks.
Sure. Okay, Mr. Walker, I'm going to shine a light in your mouth. Can you open wide? Okay, so what would his mucous membrane?
He has dry mucous membranes and his breath smells fruity.
Okay. And I'm going to assess his skin. So how would his skin be?
His skin is warm, flushed, and tense when pinched.
Okay. Okay. So just based on that data in the labs and his vitals, it looks like he's dry,
Right.
dehydrated.
Jen, we still need some respiratory.
Okay. Couple deep breaths. Okay, respirators are 30. Okay, Mr. Walker, I'm going to go ahead and listen to your heart and lungs.
Good morning, Mr. Walker.
Hi.
How are you doing today?
Oh, I felt better.
I'm Carolyn. I'm going to be your medication nurse today.
Okay.
Okay?
Yeah.
I'm going to actually check these intravenous lines, the one in your chest and the one in your right arm. I'm just going to make sure that they're functioning okay because we have some medication to give you so that you feel better.
I hope they work. They just put them in.
Right, right. Okay, can you tell me your name and date of birth?
My name's Stan Walker. I was born October 30th.
Okay. Any allergies at all?
I don't think so.
Okay.
Okay, couple deep breaths. We have S1, S2, no extra heart sounds. Lungs are clear. Check your pulses. Okay, I'm going to go ahead and assess your abdomen. Are you having any pain?
It does hurt down there, especially on that right side. When you push on it, it really hurts.
So I want you to rate your pain on a scale from 0 to 10, with 0 being no pain and 10 being the worst. How would you rate it?
I'd say if I move the wrong way or if I'm pushing on it, it's a 7.
Okay, so pain level is a 7. I'm going to go ahead and take a listen to your abdomen. Careful. Okay, bowel sounds hypoactive. Okay, I'm just going to gently palpate. You tell me when it hurts. Right up here?
Yeah.
Okay. Pain in the right upper quadrant. Bowel sounds, I told you, hypoactive, and abdomen is soft. So when did you last have a bowel movement?
Oh, it was probably yesterday morning.
And how about the last time you urinated?
I haven't been doing that much lately, but I did go a little bit down in the emergency department after they gave me all that fluid. I think it's in that jug over there.
Yeah, your urinal's right here. So what we have 50 cc's of dark concentrated urine. I'm going to go ahead and check your lower extremities. Do you have any numbness or tingling?
A little bit of numbness sometimes. I guess they said it's because of my diabetes. I can't feel things real good.
No edema. Pulses are palpable in all 4 extremities, but they're weak. And cap refill is less than 3 seconds.
Kathy, I did check the IV. There's 1,000 milliliters of normal saline. It's going into the proximal port at 500 milliliters an hour. I flushed the medial and the distal and also the right peripheral, and they flush well and they're patent. Okay, Mr. Walker, everything looks good here. We're going to get your medication ready.
No edema. Pulses are palpable times 4 extremities, and they're weak, and cap refill is less than 3 seconds.
Carolyn, before you leave, can you double check on his temperature because I believe it was elevated and he does have that Tylenol order.
Okay. Temp is, do you know the temp? Temp is 40. Okay, so it looks like he'll need his Tylenol. Okay,
Right.
I'll get there.
Thank you.
Okay, Mr. Walker, I see that the doctor has ordered for me to insert a Foley.
What's that?
It's a tube that we insert into your bladder in order to measure your urine output. We need to have an accurate reading because you are dehydrated and getting a lot of fluid.
Right.
So you also have blood work that needs to be drawn. I'm going to go get supplies for the Foley insertion, and I'm going to go get some help for the blood draw. So here's your call bell if you need anything, and I'll be back shortly.
Okay.
Hi, girls.
Hi, Beth.
I'm checking to see how it's coming along on Mr. Walker's medications that were ordered because his glucose level is awfully high.
I know, that is high. Well, actually, his saline, I checked before, it's
Okay.
going at 500 an hour. All the ports are patent and flushed.
Good.
I did get the Tylenol ready, so that is drawn up. And how you doing, Amy?
Well, I used the insulin protocol, and it looks like the bolus should be 8 units IV push, and then the infusion rate should be 8 milliliters per hour. I also have his piperacillin ready to go too.
Okay, well, it sounds like you guys have it under control. Just make sure both of you verify that the protocol matches up with
Right.
what's ordered.
Okay.
And just let me know if you need anything else.
Okay. So I guess we'll check this. See, at 540, right? Divided by 70. Okay. Okay, 7.7, we round to 8, so that looks good. Okay, let me check here. All right, that looks good. Okay. All right, so, wow, we got a lot of stuff to hang here. So how are we gonna do this? Should we put the piperacillin and piggyback it to the primary, maybe? And
I mean, he's got a bolus going still.
Right.
He needs the fluid, so if we piggyback it, it'll stop the infusion.
Right. Okay, so put this on its own long tubing, give it its own separate pump, and I'll run it through one of the central line ports.
That's what I'm thinking. And then this one will tandem at the port closest too, because that's where I'm going to give the insulin bolus.
Okay,
So
you're gonna
just combine it with the
normal saline then?
saline.
Is it compatible with saline?
I didn't check.
Oh, here, let me get my med cards. Let's see. Yeah, it's compatible, so we're good.
Okay.
All right, so you got everything, and I'll get the Tylenol, and we'll go to the bedside.
All right.
Hello, Mr. Walker.
Hi.
I'm back. I'm Carolyn.
Yeah. What
Um,
you got?
we
What you
got-
got for me?
I got some medication for you. I also have Amy here. She's working with me. She's the other medication nurse.
Hi, Mr. Walker.
Hi.
Your temperature is pretty high. It looks like you have an infection going on, and your blood work showed that also. So I have some Tylenol for you, and that'll help bring down your temperature. Might help with your belly pain a little bit too. Okay?
All right.
Okay.
And then I have some insulin because your sugar was 540, so it's really high.
Oh boy.
I know. So we need to give you an insulin bolus. Then we're going to start you on an insulin drip just to help those sugars come down.
Okay.
Okay? And then we have an antibiotic. It's piperacillin. It'll start helping you fight that infection that you have going on too.
Okay.
Okay?
All right, I'm going to sit you up a little bit so you can take this Tylenol. All right. Want a little sip of water first?
No, just the pills.
Okay. Here you go. Couple pills.
Got 'em.
While she's giving you that, I'm going to go ahead and give your insulin here.
Okay. Little sip of water. Okay.
All gone.
Okay, got it down. I'm going to put your head down because your blood pressure is still a little low.
Let me know what meds you're giving.
Oh, right. I just gave him 650, Kathy, 2 Tylenol for his temp of 40. Okay.
And I'm
then-
given 8 units of regular insulin.
Let me hand this to you. This is the insulin. And I'm going to program the pump for 8 milliliters an hour.
All right, Mr. Walker, you're all set. If you need anything, just hit your call light and we'll be back, okay?
Thank you.
You're welcome.
Mr. Walker, I'm here to insert your Foley, and I brought Beth, the charge nurse. She's going to draw your blood.
You're not going to stick me with the needle, though, are you?
No, I'm going to draw it right through your triple lumen, so you shouldn't feel a thing.
I'm sick and tired of needles.
Hey, Mr. Walker. Feel a little cold. Okay, a little pressure. Okay, Foley's in.
All right, I have your blood work. I'm going to go ahead and send it to the lab. And just let us know if you need anything, because we're going to go ahead and check on your ultrasound results to see if they're back yet.
Okay, after all that, I think I'm going to take a nap.
Okay. We'll be back in a little bit to check on you.
Okay, thanks.
Okay, your ultrasound results are back.
Oh, great. So, acute cholecystitis. So, it matches up with the symptoms he's been having in the abdominal pain
It's no wonder why his sugars were so high.
and his white blood cell count. So, since it has been an hour, why don't you go ahead and get a new set of vitals on our patient and reassess him since he's been getting so many fluids.
Okay, sounds good. Hi, Mr. Walker.
Hi, Jen.
How are you feeling now?
Better. I had a good sleep and feel really sweaty, though. I woke up, my gown's all soaked, but I feel better.
Yeah, you are diaphoretic. You're probably real thirsty, too.
I am. I
Okay.
can maybe get something to drink.
Well, since it's been an hour, I want to get another set of vital signs and check your heart and lungs because you've been getting so much fluid. So when I'm done with that, I'll go ahead and get something to drink and we'll change your gown.
Okay.
Okay? So, Kathy, we have a temp now of 37.5. Heart rate's 109. Blood pressure is 114/54. Pulse ox is 98% on room air. I'm going to go ahead and put your head up a little bit more since your blood pressure is better.
And it sounds like my fever went away.
Yes, and that's probably why you're sweating. Okay, let me go ahead. I'm going to get some respirations here. Okay, respirators are 24. Go ahead and listen to your heart real quick. Okay, give me a couple deep breaths. So, Kathy, we still have S1, S2. Lungs are still clear. I'm going to go ahead and check for some edema. Nope, no edema.
And we haven't had a urine output since you put that Foley in.
Okay. Looks like we have 200 cc's of clear yellow urine.
You know, we drew those labs a while ago. By any chance, do we have those results back
Yes,
yet?
those labs are back.
Okay.
Here they are.
Oh, okay.
Better.
So it looks like he's rehydrating for sure with
Something's
those.
going up. Potassium's dropped, though. It's probably because of the insulin.
Insulin drip. All right, his glucose has improved too, so I'm sure that that's going to need to be adjusted, his insulin drip rate. Well, we got the assessment. We completed all these orders. I have these new labs. I think I'm going to need to call the doctor at this point.
Okay.
Okay.
Hi, Dr. Quinn. This is Beth. I'm the RN caring for
Hi.
Mr. Walker.
Uh-huh.
He's the one who came in with DKA.
Oh, yes, I know him.
Okay, well, his vitals have improved since we started him on the IV fluids. His last set of vitals were temperature of 37.5, heart rate of 110. His BP has improved, though, to 114/54. He has a respiratory rate of 24 and pulse ox of 98% on room air. Since he's been on the unit, we went ahead and kept the normal saline fluids going at 500 milliliters an hour. An insulin drip was started per the protocol at 8 milliliters an hour. The antibiotic was administered 1 dose so far, and Tylenol was given for elevated temp. Since his Foley's been inserted, he's had 200 milliliters out. However, he is still complaining of abdominal pain in his right upper quadrant, but I do have his ultrasound results and his lab work.
Oh, great. What are they?
Okay, well, his ultrasound did show acute cholecystitis, which makes sense. His sodium, his last set of blood work sodium was 131, chloride of 97. His potassium has decreased to 3.1 since the insulin drip was started. Glucose is 356. CO2 is 20, and BUN is 25, and creatinine is 1. And so I was calling to see what you wanted to do.
Okay, good. It sounds like we know what put him into DKA with that infection, but he is rehydrating well. We need to add some more potassium chloride to his IV, and then go ahead and get a surgical consult. I'll send the orders over the computer, and call me if you need anything else, okay?
Okay, thanks.
Okay, here's our new orders.
All right. Oh, medication nurses. Amy, I would like it if you can go ahead and switch over those maintenance fluids. The new order is for normal saline with 40 of K at 350 milliliters an hour. And then Carolyn, if you can go ahead and adjust the insulin drip rate per the protocol for his new glucose level of 356.
Right, okay.
Okay.
356, right.
All right,
Okay.
thank you.
Okay.
And
thanks.
John, just so you know, he's going to need a surgical consult based on his ultrasound results, and he'll need his labs redrawn in about 3 hours.
Okay, good, got it. Mr. Walker,
Yes.
we just got some new orders from the physician, so we are going to go leave and page the surgeon while your medication nurses get your new meds ready.
Okay.
We'll be back shortly, okay?
Okay. Thank you.
Hi, Mr. Walker. It's Amy and Carolyn again.
Hi.
How you doing?
Pretty good.
Good. Well, we got some new meds for you. We have some new IV fluids with some more potassium. Your insulin drip that you're on is making your potassium drop a little bit, so we're going to just change those. And then your blood sugar came down nicely too, so we're going to adjust your insulin rate.
It sounds like I'm getting better.
It sounds like it. What's your name and date of birth, please?
Stan Walker, and I was born October 30th.
Okay. And do you have any allergies?
No.
Okay. We're going to go ahead and hang these now.
Okay, Kathy, I stopped the infusion protocol, the insulin infusion protocol. We're going to stop it for 30 minutes based on his new blood sugar, and then restart it at 5 milliliters an hour.
All right, Kathy, I'm hanging normal saline with 40 of K at 350 an hour. Okay. All right, and go ahead and just call us on the call bell if you need anything, okay?
Okay, thank you.
Med nurses, I'm just going to check your work here, make sure you hung the right meds. Right, it's good.
Hey, Mr. Walker,
Hi, Jen.
how you doing?
Okay,
I'm feeling
good.
better.
Good.
Still having that pain in my side,
Yeah, still having that abdominal pain.
though. Yeah.
Listen, we got your ultrasound results back, and it shows that you have an infection in your gallbladder, so it's no wonder why you've been so ill these past couple of days.
Oh, jeez.
So we're going to wait for him to come up, and he's going to talk to you about the procedure and have you sign a consent form.
Okay, John, I hate to interrupt, but the surgeon is on the floor.
Okay, Mr. Walker, Beth and I are going to go and talk to the surgeon and get him updated. So if you need anything, just use your call bell, and we'll come in in a little bit and check on you.
Okay, thanks.
Okay.
Okay, group, good job. The scenario's over, so let's gather and do a little debrief. So how do you think it all went? How did it feel?
Mm-hmm.
There's a few things that we could have done differently.
Yeah, I
think
agree.
you did a really good job.
Okay, John, I don't want to interrupt, but the surgeon's on the floor.